so my name is Myriam. I'm the kinesiologist here at the clinic. We're going to show you some exercise today for pre-surgery and after surgery that you can do. Frederic is our model today. So what we're going to show you is not exercise that's really high in, not really demanding, but it's important for the joints and the range of motion. So that's what we're going to try to get today. So it's supposed to be simple but efficient. So we're going to start with what we call a leg extension, sitting on the chair. So what she's going to do is that she's going to lift her knee up, bring her toes towards her, and then push forward. And then just keep there, So what you want to do is make sure that you keep this really contracted, and then come back and then down, okay? So this is like the most advanced. If you want a modification of that, what's important if you have a strap, so some kind of yoga strap, a belt, anything like that at home. So we're going to use the strap to show you the modification. So go at it. Okay. So what's important to know is that maybe at first you won't be able to lift your knee fully. Maybe your hip don't have the range of motion, or you have too much pain in your knee. So what you can do is half. So you're going to lift up just a half and then push. And you want to keep contracting for maybe 5 seconds and then come back and down. Okay, so that's the modification. So it's not really a big deal if you cannot lift it up really high. I want you to go until what you can achieve. So you just kind of lift it up, push, then come back. So what we want to do is kind of work on the attachment of the muscle to your knee, and then the strain and endurance of your muscle in your quadricep. Okay, so she's a bit sore, so she's struggling. Okay. Next one is a squat. Okay, so everyone needs to be able to get up from a chair or your bed or whatever you need to be functional. So squat is like the basic of what you can do at home before surgery and after surgery to get your body moving. So we're going to show you different versions. So the first version is the most difficult one, where you start sitting on the chair. You want to put your leg shoulder width apart, and then you just want to put your hands either on your chest or beside your body, whatever works for you. And so what she's going to do is that she's going to slowly push up. Good. And then she want to bring back her head back and then sit back on the chair. Okay. So what's important here is that she keep her knee aligned. So you could see that she had a little bit of trouble. So what she can do, that's fine. What she can do is she can bring her the back of her heel closer to the chair, and then she can try again. Good. Then she want to bring her head back and then slowly back down. So maybe for most of you that is going to be a problem because it's going to be too hard, or you have knee problem, or you have any difficulties. So what we can do is to modify it with doing maybe just half a squat. What you want to do, you want to start on standing position. Yeah, we're going to just turn the chair. Okay, just switch. Yeah, okay. So what we're going to do is that she's going to, if for your knees it's too hard, what you can do is to bring the base of support wider and then open your feet a little bit. So it should help with your knee. And then what you want to do is like maybe half a squat. So she's going to bring her hip back slowly and then slowly come back up. And that's the only range of motion she's gonna try to kind of reach. And then you do that for maybe 2 series of maybe 10 reps, and then after that you can stop. If even that is a bit too hard, what you can do is to hold on to anything in your house that have support. So here we have the wall. So what she's gonna do is to hold on. She's gonna push against the wall and then slowly back up. And with this, you can also progress. You can bring your butt a little bit lower if you need to, and then back up. And you can do the same thing with your legs. You can go wider to have a better base of support, and then less pressure on your knees. And just one more time. And then up. Okay, perfect. So for squat, that's pretty much it for now. The last exercise is for your shoulder. So we want to get shoulder range of motion. So what we're going to use is a broomstick. Most of you probably have that at home. So she's going to go at it. So what you want to do, you want to put one hand on the middle of the broom, and then the other one, your thumb should be kind of facing, yeah, exactly. Good. And what you want to do is to make sure, I'm going to go on the other side. Okay. You want to try to keep some kind of slight flexion of the elbow, but not too much. So I don't want a full extension, so she's double jointed, but so just like a slight kind of flexion. Okay, so what you want to do is you want to push up. Full range of motion is what she's going to show you. Okay, then slowly back down. You don't do the exercise. I don't want any, it's not supposed to be fast. It's supposed to be kind of steady. So you want to go up, slowly. And you want to help with this arm, kind of helping this arm go up. And then if it's too hard, if you have any shoulder problem, any ligament, anything problem, you can do half of it. So you can just push up. And when you feel pain, you want to stop. So as soon as you feel any kind of pain, you want to stop, kind of take a deep breath, and slowly go back down. Okay, that's perfect. Okay, good. So for shoulder range of motion, this is the exercise you can do at home. So pretty much we only showed you 3 exercises. So you have the leg extension, the squat, and the shoulder abduction. It's pretty simple, it's pretty efficient. It's not something that's really hard and you're not gonna sweat a lot, but what we're trying to get, it's really just movement, range of motion, and blood flow. So that's what you're trying to get. So at first, even before, after surgery, you're not trying to kind of beat yourself up, you're just trying to make sure that your body is able to move in a functional manner. That's what we're trying to get. So that's only 3 examples of exercise. What we're going to do after for the program that we're building is that you're going to have a full program that you can access, that you can see, and that you can do at home to make sure that you progress slowly after the surgery or before, if you want to get ready for surgery and have a better chance at rehabilitation after. So if you have any question, let me know, and otherwise, thank you.